All right. Welcome everyone. So as we're trying to get all the technical difficulties all remedied, let's just welcome you all to year 2022. It's going to be an amazing year. If you're watching, let us know where you're watching from. We're doing this stream from Nigeria, and as you can tell, yeah, as you can tell, it's live. I'm super excited. This is the first time we'll be doing actually a live with a guest here on YouTube. So I'm super excited. I'm thankful for StreamYard that is making this possible. Today's talk today is drug use in pregnancy, and we have some couple questions coming that we're going to be answering. We have our amazing guest here today, and I'm going to have him introduce himself. And he's a very special guest. All right, over to you, Igor Femi.
Thank you so much, Midwife Victoria. It's a great pleasure to be here today. I think I'm excited to be part of this video and this educating video with you. Yeah, my name is Iga Femi Sunday. I am a pharmaceutical personnel, and I've been in the field of pharmacy for over 4 years. So I'm excited to get to talk about drugs here. Thank you.
Yeah, so excited. We're excited to have you. And just to be sure this stream goes well, especially with the video, because some people will be watching, will be doing a replay of this. And by the way, if you're doing a replay of this, make sure you give this video a thumbs up. Make sure you leave a comment in the comment section. And even if you have questions, leave them there because Igor Femi Sunday will go ahead and answer them even in later in the future. All right. And if you're not subscribed to the channel, what are you waiting for? Go ahead and hit the subscribe button. All right, Igor Femi, do you mind moving a little bit more to the center? It might be your camera, you move
Okay.
yourself.
Something like this.
Yes, that's perfect. That's absolutely perfect. Thank you very much. All right, to start, what is a drug? I think we should just start from that. What is a drug?
Yeah, thank you so much. I do hope you can hear me, right?
Yes, we can hear you
Very well.
perfect.
Okay. Okay, I would go pharmacologically. A drug is any substance that has a known structure. So when you administer this substance to living organisms, it produces a biological effect. And most of these pharmaceutical drugs that you call medicine or medications now, they are used to treat, they are used to cure, and they are used to prevent. They are also used to promote well-being of an individual. That is a drug.
Wow, that's amazing. So a drug is something that is other than food, right? And it's
Yeah,
used to treat. Okay.
yeah.
All right. Thanks for that. I get a lot of questions, and even me myself, I wonder. There are lots of medications out there that would say do not use while pregnant, or do not use if you are breastfeeding, or it would say consult your doctor if you're pregnant. There's a lot of do not. And so sometimes I know pregnant women are like afraid to use some medications because there's always that warning on most medications about pregnancy, lactation, and breastfeeding, which is the same thing as breastfeeding. Do you want to tell us a little bit why there's always that warning signs on most medications?
Yeah, thank you so much. Actually, in selecting medication, one have to be very careful, especially when you are pregnant. Even when you are not pregnant, these medications, they are called chemicals. And, it's going into the body and the liver metabolizes it, and it gives the liver a lot of work to do. And each of these medications, they have their effects in the body. So they will actually give you a desirable effect that you want, but they will also give you an adverse effect or side effect, which is an unwanted effect. So which can be harmful to the body. So in selecting or in taking medications, one has to be very, very careful, especially when you are pregnant. It's not just about you alone, it's about your baby as well. So you have to be careful in selecting pregnancy medications to prevent or not to damage your baby. So that is why there are so many medications that when you take them, they just cross the placenta and it actually harm your baby. They could cause birth defects. Some of them could cause miscarriage. Some of them could cause stillbirth. Some of them could even disable the brain of the baby. So that is very important that you consult your physician or your doctor, whoever that is in charge of your pregnancy before you take medication. So yeah, these are the reasons why one has to be careful before taking medication.
Wow, that's amazing. Thank you so much for sharing that. So to just highlight your answer, you said there's a lot of warnings on medications because those medications can cross the placenta. And if it crosses the placenta is the organ that attaches your baby to the mom. It can negatively affect the baby. And that's why it's important that you talk to your doctor, your nurse, your midwife before you use any medication, especially if you're pregnant or you're breastfeeding. All right, thank you so much for that answer. We have people here. Josie Connor, welcome, welcome, welcome. Let us know where you're watching from. Thanks for the thumbs up. Help us share this video so other people can watch as well. All right, and if you have any questions, make sure you leave them in the comment. Okay, so to our next question is supplements. So we hear a lot about supplements. What are supplements? Are supplements the same as drugs?
Yeah, the supplements, that's what we call dietary supplements. Normally, there are a lot of vitamins and amino acid and all of those stuffs that the body cannot synthesize, and all these things could be gotten from food. And the scientists have made it so easy for us to have them in form of supplements, which they would extract them from food and make them in form of capsule, in form of pills, in form of tablets, in form of powder, in form of liquid, that it would also augment so that you have a sufficient intake of these supplements. By examples, including your vitamins, your amino acids, your minerals, your fatty acids. So all these supplements actually helps your body to grow, helps your body to fight against foreign bacteria or foreign matters that comes into the body. All these supplements also helps you to grow. And all these supplements also helps your tissues and your cells to be able to function very well. So that is supplements. So we have the dietary intake. We also have the ones that are also involved that are available in form of tablets, which is drug. Yeah.
All right. So you're saying that a supplement is from your food. It's we call them dietary supplement because they're actually taken from food and they are to help augment, which in other words is to like supplement, which is the same as supplements to make
Yeah.
your food more wholesome.
Yeah.
Especially today when we have like our soil that is not as rich as it should be. So taking dietary supplements can help you get all the nutrients you're supposed to get. So supplements are not to treat, would we say? They're not to, I mean, I guess you could use it to treat something, but they're not medications per se. What would you
Yeah.
say?
They are medications. We have supplements that are available in form of medications. They call it synthetic supplement. Are you getting it? So that is like the iron supplements, the vitamin supplements, calcium supplements, and all of these ones. So they're available in form of tablets, which would also use to supplement the diets that you're taking.
All right. Thank you for the analysis of that. Okay, let's go to our next question. If you're watching this on replay or if you're even here now, make sure you give this video a thumbs up and comment below where you're watching from. And if you have any questions on drug use in pregnancy, you can leave them below. All right. So our next question is, what are the drugs used in pregnancy? So there are some drugs that we know are contraindicated. There might even be OTC, how do we say that?
OTC, yeah, over the counter drugs.
Thank you. They could be over the counter drugs, but they might not be safe in pregnancy. What would be what are some of those that you would highlight that maybe you've come across before and it's really not safe in pregnancy for our women and men to know?
Yeah, thank you. Where a lot of drugs are used in pregnancy, and you would classify each of these drugs either they are safe or they are not safe. So perhaps if someone wants to get rid of a baby, an abortion or to clear the fetus, probably there is miscarriage and the likes, there are drugs that are also to be used, which would also promote that aspect. Because there are other drugs that are also used, probably if the mother is sick of any particular condition, that would also help the mother to feel much better. But this drug should be carefully selected such that it will not harm the baby. So that is why it is very, very good that when you are pregnant, you should be mindful of what you take, medications especially, because most of the medications crosses the placenta and they would harm the baby. And not only that, even what you eat, your lifestyle also is very important. Like the consumption of alcohol during pregnancy actually affects the baby. So it's very important you are very, very careful. So there are a lot of medications that are contraindicated in pregnancy, and there are a lot of medications that are also very, very safe in pregnancy. So I will just give some class of these medications and give you some examples and I'll explain how they are very safe. So we
All
have
right.
drugs like antiemetics. Antiemetics drugs are usually used for when you are vomiting, having nausea, or you are having or to prevent motion sickness. So that's what these drugs are meant for. And these drugs, while taking each of these drugs, drugs in this class are to be carefully selected because most of them are very safe and most of them are not very safe. So that is why your doctor would know the best and the safest medication for you in this class of drugs. We also have drugs called antacids. The antacids are usually used to neutralize your acid. Normally when you eat, the stomach produces an acid, HCl, and which is used to digest your food, to break your food into smaller particles. But when the food is no longer there, the acid is keep producing it. They eat up the mucosal layer or the lining of the stomach, causing wound. So you take antacid to neutralize those acids, which would promote healing in your stomach and also prevent heartburn or relieve you of heartburn. And these antacids are available in liquid, they're also available in chewable tablets. For examples are they have what we call a Mismark, magnesium trisilicate, and we also have the chewable one. So I think it will be much better that when you have each of these conditions, your doctor will actually know the best one that is very safe for you. So, and also we have drugs that are called antihistamines. The antihistamines are medications that are used for when you're having an allergy, call it allergic rhinitis, you're having a common cold, you're having influenza. Influenza is like a infectious disease that is caused by a virus. Then the medications in this class are usually used. So probably when you have an insect bite and you start having reactions, so that all your body is stressed up or is itching you or something.
Mhm.
So drugs in this class actually promotes your well-being, helps you to relieve you of those allergies. And we have a lot of medications, a whole lot of medications in this class. And they are available in form of injections, they're available in form of tablets, they're available in form of liquids, and some of them are also available in form of infusions. So, and your type of condition would actually determine the kind of medication that is safe and is best for you. So we have analgesics, which are commonly known as pain relief painkillers.
And we're
of.
about to get to that, but I'm glad that you're talking about it. So go ahead.
So we have analgesics that helps to relieve you of pain. Normally, pregnant women are usually like they usually come up with
A
pain,
lot
like
of
probably
pain.
pain
Yeah,
in the
back
joints,
pain.
pain in the body, and all of that. Usually come up with dizziness, runny nose, coughing, and all of that. And most of them usually come up with fever too.
You're right.
So yeah, actually, medications in this class are actually to be carefully selected because most of the medications in this class are not safe for pregnancy. They could actually
Wow.
damage, yeah, the fetus. So
Can
for
you give
me,
an
actually,
example of those medications, especially pain medications that are very harmful in pregnancy?
yeah, there are a lot of medications there are a lot of pain medications, especially most of them are available over the counter. I don't really need prescription for them. And, people can
Oh,
just get it. We have ibuprofen, we have aspirin, we have naproxen, we have most of them are like very common. So these ones are have diclofenac as well. So these ones are very much available for people to
but
use.
they're not safe in
Yeah,
pregnancy.
yeah, they are not safe for pregnancy. I usually recommend paracetamol, which is
Okay.
acetaminophen, which is one of the safest medication in pregnancy. That's a very low risk. The other ones has high risk in pregnancy. So it is very important that you consult your physician or your doctor or your healthcare provider before you take this medication.
Absolutely. Wow, you've lectured us so much about all these different ones, the emetics, anti-emetics, which is anti-vomiting or nausea. You've talked about, let's see if I remember all the highlights. Anti-emetics, antacid for heartburn, which is very common in pregnancy. Let me know in the comment section, my pregnant women, those that have given birth before, did you vomit? Were you nausea in pregnancy, in your pregnancy? Share your experience with us below and let us know what you did for it. Did it go away by itself? Did you have to take something for it? I have a friend right now that she's going through pregnancy, and our first trimester was very, very bad. She was vomiting a lot, and she actually couldn't eat for like the whole first trimester. She could not eat, and so it was really, really hard for her. She lost a lot of weight. So this does happen in pregnancy, and I like when you also talked about antacids because that's also a big one. When your stomach is full of your baby's growing, it's pushing your stomach up. It makes all your food like come back up, and the acid also coming back up. So it's not nice. So thank you for sharing some of those things with us. Um, the last question, because we're trying to end this and just make it short and sweet. And we're going to do part two. If you guys request for this, we'll try to do part two of this live. The last question was about painkillers because I think that's a big one because a lot of pregnant women get pains in their back, which can be due to posture or just the way the baby's laying. I was just watching a video yesterday of a mom that had what is it called, sciatical pain, and that thing is just really, really bad. I've also seen a dad. I mean, he wasn't pregnant, but he had sciatical nerve pain, and it was just really, really bad. So I know it can be really, really painful. Let me know in the comment section if you've had sciatical nerve pain before. And she said she was told to take some analgesic cream for it, and they told her that it's not safe for the baby. But I mean, you can't kill yourself if it's painful. And so they told her to take it as needed. I think they told her not to take it more than 12 times. And so no, I think it's not more than 4 times, something like that. So I know there's sometimes that what you have, it's more than, like, even if it's not safe for your baby, your own body needs something to just cope at that time. But just make sure, I think you've kind of like helped us to analyze this, that make sure you're talking with your doc, with your healthcare provider, so that they are monitoring you and they can tell you which is best for you at your time. All right, as we're ending this as we're ending our life, sorry guys, I'm looking at my questions. As we're ending right now, what will be your last advice to pregnant families that are going through pregnancy and about drugs in general? What should be the approach to drugs in pregnancy?
Yeah, thank you so much. Like I said, especially in pregnancy, drugs are to be selected or given whenever it is very necessary. Like for examples, when you're having pain, it could just be as a result of little stress, which naturally, when you go to bed or you relax or you eat or you take water, might actually go. So, but most people might actually want to request for medications. But that is why most doctors will just say that, oh, you don't really need medication. You just have to just relax. You just have to just take water and all of that. You just go. And the most important one is that when you eat well, healthy food, you get like virtually most of these nutrients in food, like your folic acid, like your iron supplements, like your vitamin C, your vitamin D. All these supplements are very, very, very important. And all of these supplements has their own ways of working. Especially most of them are very important in your baby, especially the folic acid. The folic acid actually prevents your baby from having a neural tube defects, and the folic acid also prevents you from having iron deficiency anemia. The vitamin B6, which is also known as the pyridoxine, also helps you to prevent baby defeats at early stage. So all these things are very important. And most pregnant women usually come up with a lot of infections. Could be yeast infections, could be vaginal infections, could be um, chronic obstructive infections, coughing, and all of that. Actually, there are medications for these infections, but this is very important that a test is carried out and the doctor is carefully selecting the medication that is very safe for you. So, being a pregnant woman, it can actually, if you eat well and if you do exercise, not a vigorous one, and you are very active, you might not really need any of these medications. But the supplements are actually very important for you. You can get them in your food. You can know you cannot get them in your food. It's better you get the supplements like prenatals. All these supplements I just mentioned are all available for you, and it will also help you to augment your body function. So thank you. That's what I have for them.
Oh, thank you so much for ending. I feel like you helped end it strong. There were more questions, but we just need to end the live now. We look forward to having you again. But I just wanted to just bring out the ending part that you gave. That drugs are to be used to treat and all of that, and supplements are great. But that the best way to make sure your pregnancy goes well and you get all you need for yourself and for your baby is to eat well, right? To eat
Absolutely.
healthy balanced meals, protein, carbs, water, fat, oil, all those stuff in your food. Those are the best ways. And usually with this, with exercise, um, usually you'll be good to go. And of course, registered with a healthcare provider that helps monitor your pregnancy would also help so that you don't need many medications, during your pregnancy. All right, we are going to end here today. I really enjoyed this talk about drugs and pregnancy. I look forward to a part two because I feel like we need more time for more things, but we just
Yeah.
wanted to make it short. For those that are watching or those that are watching on a replay, if you have any questions for our pharmaceutical personnel here, you can leave it in the comment. He's going to be reading them and he will try to answer them. If not in the comment, it will on our next live. So yeah, thank you so much, Igor Femi, for coming. We really appreciate you. And how can people support you or book a consultation with you, or if they just want to talk with you one on one? How can they reach you?
Yeah, thank you. You can reach me on my Instagram page, Igasi Femi. You can also reach me on my Facebook page, Igafemi Sunday. So, or you can reach Victoria. She has a way of reaching me too. So, I will get all your answers, all your questions answered there.
All right. All right, thank you for that. So, guys, here you have it. Until next time, be the best that you can be, and we'll see you on our next video. And by the way, if you haven't watched the video that went live on Tuesday, yes, on how to conceive twins, make sure that you go back and watch it. Make sure that you share, and we'll see you on our next video. God bless. Bye bye.
Thank you.
Thank you. Bye, everyone. Thank you, everyone. Bye. Trying to have a broadcast. By the way, since this is still going, if you like me to go live like this, I'll be answering questions. Um, Wow, I'll be answering questions in my live video. I'll try to do this weekly or as often as possible. So leave me questions on my DM, on Instagram, or even here under the live video. I'll make sure I read them and answer it in my next live. All right. God bless you. See you guys in my next video.